Milton Keynes University Hospital NHS Foundation Trust have created a new sepsis screening tool. There are approximately 123,000 cases of sepsis a year in England, with around 36,800 associated deaths. Sepsis now claims more lives than lung cancer, the second biggest killer after cardiovascular disease. Sepsis as being a leading cause of avoidable death, killing more people than breast, bowel and prostate cancer combined. It's a condition triggered by infection where the body's immune system goes into overdrive, setting off a series of reactions that can lead to organ failure and in some cases even death. Unless treated quickly, septic shock has a mortality rate of 50%. Often, people do not know they have sepsis and may have symptoms easily confused with common infections or illnesses. Sepsis does not discriminate. At Milton Keynes University Hospital NHS Foundation Trust, we are replacing the old Sepsis Proforma with a new sepsis screening tool. This aims to increase the early recognition of sepsis and the clinical response to those identified as at risk. The sooner you recognise sepsis and treat it, the better the outcome. We can save lives. Rachel, the nurse, completes observations on a patient and records a news score of 4. Because the news score is over 3, Rachel decides to screen the patient for sepsis with the guidance of the sepsis screening tool. In emergency and admission units, all patients should be screened on initial triage or clerking. This can be started by either the triage nurse or the clerking doctor. On the inpatient wards, please think sepsis and use the screening tool if the news score is 3 or above. You can also use the tool if the news is less than 3 if you are concerned the patient looks unwell or worse than usual. In emergency and admission areas, the tool is part of the clerking Proforma packs. On the inpatient wards, the screening tool will be found on ward round trolleys, near the observation chart storage areas, and in the ward sepsis box. Rachel notes that Brenda has a news score of 4 and recalls that the patient was short of breath. She checks the box in section 2. Brenda does not have any red flag signs, so proceeds to follow the prompts on the form to the amber section of the tool. Rachel remembers that Brenda's relatives stated that the patient was a bit more muddled at lunchtime and not quite herself. Rachel uses the SBAR process to clearly communicate with the junior doctor on call the situation and the urgency of the review required. Laura asks Rachel to contact her if the patient deteriorates whilst she is on her way. If the patient has amber sepsis but with AKI or a lactate above 2, escalate the patient to red flag or severe sepsis, which requires a senior review. Laura explains to Brenda that she may have severe sepsis, and to treat her we will use a regime called the Sepsis 6. Sepsis 6 consists of 3 things in and 3 things out. In, give IV antibiotics within an hour, oxygen and IV fluids. You might want to consider a urinary catheter too. Out, take bloods, recheck lactate after fluid challenges and measure regular urine output. Laura completes the remaining sections on the screening tool and prescribes the relevant antibiotics. If after delivering the Sepsis 6, the patient still has a systolic blood pressure of less than 90, reduced consciousness, a respiratory rate over 25, or a lactate that is not coming down, consider calling your senior and discussing with the DOCC team on call immediately. Remember, sepsis can kill quickly, so you need to act fast. Once the immediate resuscitation is over, you must always check the Trust's antimicrobial policy or treatment guidelines for the right choice of antibiotics dependent on the likely source of sepsis, the patient's age and their allergy status. Always review the antibiotic use and appropriateness within 72 hours. Always document the sepsis diagnosis on the patient's discharge summary so the GP, patient and coding team know. Always offer patients an information leaflet and a full explanation of their diagnosis and prognosis.